Well, meanwhile, over at a private practice in Johannesburg, Dr. Daniel Israel tells us he's been so busy, and at one point he diagnosed at least 20 patients with COVID-19 in a 24-hour period. We're very lucky to squeeze in an appointment with him now to chat live. Dr. Israel, thank you so much for joining us. Just give us some idea of what's going on in your practice and what your colleagues have been telling you.
Thanks for having me on the show. So I don't think my practice is any different to any of the other practices, which is important to understand. And I think that the 20 cases per day is probably 20 cases. It's been every day and in most practices. We're really dealing with an absolute influx of COVID-19 patients. Thankfully, not always in the rooms. Patients in the private sector have learned not to come in and they've learned to phone in. But that creates a lot of stress in terms of having to deal with patients who are unwell at home, on the phone, sending nurses to go and do bloods where possible, patients at home with oxygen where oxygen's available. And then obviously really the hardest part is when you need to put a patient in hospital and there just are no beds, both in the private and the public sector.
Are hospitals diverting yet? Are they telling ambulances that they can't take patients in the private sector?
So the private sector has been very accommodating in terms of using their casualties as triage hubs, so to speak, to work out, who needs the beds worse than others. But certainly as GPs, we deal with physicians a lot and we send patients directly to wards. And if I phone most of my colleagues in northern Johannesburg, they will tell me that, they don't have beds, or they might accommodate a ward bed, but not a high care bed. And we know that 20 to 25% of patients being admitted at the moment are actually needing high care or ICU in the end. So, we really are in a situation here where we are managing patients at higher levels of care remotely and, on a primary care level.
What's the situation with those in high care? Are they needing CPAP? Are they needing ventilation? What's the oxygen availability like there?
So there still are... there still is oxygen available, and at least from a GP perspective, thankfully, we're still able to get oxygen for patients on the outside. In high care and ICU, physicians have learned that it's not just about putting patients straight onto ventilators. So with high flow oxygen, CPAP, and improved ventilation, there is a higher survival rate, so to speak. But, obviously, as the numbers rise, the pressure on the system and on the supplies becomes more and more. And we're sitting in a situation where we're threatened by in the future not being able to get enough oxygen.
One of the reasons that we actually wanted to do this segment of the show is, you went through the first wave and you were prepped and you were energized and ready to help people. You went through the second wave and you were sort of, yeah, we can do this. You're now sitting on the third wave. How are your reserves and resilience holding up?
I think all the doctors are burnt out, all the doctors are exhausted, and the truth is that if you look at any type of family life or, balance in life is absolutely non-existent at the moment. But the reality is that there is a huge amount of goodwill between both the private and the public sectors and amongst colleagues. So we really are all standing together on a daily basis and managing to help people. On a personal level, I'm enthused every day when we're able to help people and really take them through this. But the problem is that as the numbers grow, there's only a certain amount of patients per doctor that we can each accommodate. So it really is very challenging and therefore mentally overwhelming.
Doctor, thank you for being so frank about that. I mean, I know so many doctors who are really going through emotional burnout. What's your advice right now for us to get through this?
So, I've been following your programming and I've watched what the Minister of Education has said, and I commend the huge efforts of government in terms of vaccination. But the reality is we all know that in our country things take time. And we're unfortunately not in a position where we're able to rely on vaccines as a way to get through this wave. We have to be now in a position where we each take personal responsibility. I certainly believe that children should not be at school at the moment. I'm not saying permanently, but until there is a good immunity amongst teachers, I believe that socially people should be very guarded. You don't get COVID by going in a controlled way to an appointment or something like that with a mask on. But certainly, sitting at home and having a social interaction with food and drinks and is how most of my patients are getting COVID. So this is a time to really lock down on a personal level and therefore take an immense pressure off the system that's already under a lot of pressure.
Well, that was Daniel Israel, a private doctor based in Melrose, north of Johannesburg. Thank you so much for your time. That we know is you've got a waiting room full of patients there. Once again, thank you.